My name is Josh Mugel. I'm the Emergency Medicine Program Director. I've been with the health system since 2019. So one of the things that I really enjoy about being a newer program is that we get to start this from the ground up. And when you start something from the ground up, it means that you get to set the vision, you get to set the values, you get to determine why it is that we're doing what we're doing. And so we put a lot of thought when we decided to start this residency. We put a lot of thought into why are we doing this? What are we doing? What are we doing differently? And who do we want to be as a residency? We do feel that we have the tools to become an elite residency, to really train top-notch, world-class emergency physicians. So that's our vision for our program. We really wanted to make a point also when we started this residency of defining what our core values are. Why are we doing what we're doing? And so we came up with, and we had a lot of debate, we came up with a list of 6 core values. They're on our website, they're why we do what we do. And they infuse everything that we do. Whenever we develop our didactic sessions, whenever we come up with a curriculum, whenever we hire people, we are trying to adhere to these core values. And so we're not taking a residency that's been here for 20 years, that has a history, that has momentum, that has inertia, and we're trying to change the course of that ship. We're doing something brand new, and we're doing it right. And so we're going to come in here, and we know how we want to train residents, we know why we want to train residents, and we're going to do that in everything that we do. So there's a lot of things that we look for in a candidate who comes into emergency medicine. One of the things is that we are a very busy emergency department. So we want somebody who's going to hit the ground running, somebody who can come in, see a lot of patients, work hard, and really make a mark in the department and see a lot of patients. But we're also looking for somebody who gives back to the residency. We are a newer program, and we are still shaping our residency, and we are still very open and receptive to feedback. So we want somebody who's not just going to come in and absorb an education and learn to be a doctor. We want somebody who takes some ownership of their residency experience and makes it their own and really helps shape it for the rest of the community. I was surprised when I first came here at how busy this emergency department would be. When I looked at a map, Gainesville looks like it's a little bit more rural than I would have expected. We're about an hour northeast of Atlanta. We're in a little community on a lake, on Lake Lanier. We're also pretty close to the foothills of the Smoky Mountains. So geographically, it's a beautiful, beautiful place. Again, I thought just visiting the town that the hospital system wouldn't be that big, but I was very surprised. The hospital system actually serves about 17 or 18 different counties, and so our catchment area is close to 2 million people. This means that we're a busy, busy hospital system. We're a trauma center, we're a comprehensive stroke center, we're a STEMI receiving center. So we essentially act as a tertiary care hospital. In our main hospital, we see over 100,000 visits a year. In the secondary hospital, where our residents will rotate, we see about 60,000 visits a year. So we see a ton of people. About 18% of that is pediatrics, and all sorts of acuity. I do very strongly believe that our patients are our best teachers. And so I think this is one of the main reasons that I wanted to start a residency here at Northeast Georgia, was because of the acuity, the patient mix, the variety of patients, and also just the crazy busyness of it all. So Hall County is a very diverse area as well. We have a good payer mix here, so we see a lot of vacationers coming up from Atlanta, a lot of more well-to-do people, a lot of people who've been in Gainesville for a while, but we also have a lot of transplants coming into the area. We also have a lot of rural working poor, and then we have a large migrant community as well. So about 40% of the people who live in Hall County speak Spanish primarily, and so we have a good opportunity to serve a very vulnerable patient population and to make a difference in the community in which we work.